Coming up next on Insights on PBS Hawaii, when will Hawaii's patients be able to buy medical marijuana? Aloha and welcome to Insights. I'm Mahealani Richardson for Insights on PBS Hawaii. About 13,000 Hawaii patients with debilitating conditions are registered with the Hawaii Medical Marijuana Program and have been prescribed medical marijuana by a doctor. Since the year 2000, these patients have been allowed to grow their own medical-grade cannabis or have a caregiver grow it for them. A recent task force found that current laws force some patients to become criminals because they have no legal way of obtaining medical-grade marijuana to ease their symptoms. Lawmakers are considering ways to fix these flaws during the current legislative session. Tonight, when will Hawaii patients be able to buy medical marijuana? You're invited to join our conversation tonight by calling 973-1000 if you live on Oahu or 800-238-4847 if you're calling from a neighbor island. Insights is also streamed live at pbshawaii.org for your smartphone, tablet, or computer, where you can join the live discussion, or you can find us on Twitter at PBS Hawaii. Now to our panel. Alan Shin is the executive director of the Coalition for a Drug-Free Hawaii, which provides substance abuse and prevention services to Hawaii's children and families. Della Al-Baladi is the state representative for the Makiki, Tantalus, Makali, and Papakolea communities. She's the chairwoman of the House Health Committee, which has held numerous hearings on medical marijuana. Pamela Lichty is the president and co-founder of the Drug Policy Forum of Hawaii, an organization established to encourage discussion and education about alternative drug policies. And Douglas Chin is the state attorney general. He previously spent 12 years with the Honolulu Prosecuting Attorney's Office. His office favors rigorous controls on medical marijuana. Good evening to you all, and thanks for joining us tonight.
Thanks.
Thank you.
Thank you. Representative, why don't we start off with you? A flurry of medical marijuana bills in the legislature this session. Will something actually pass on dispensaries this time around?
I am optimistic that something will pass. What that something is still in negotiations, but it is something that is a high priority.
And this would allow only medical marijuana patients to be able to buy it from a dispensary, right?
Yes, and to answer your question, under the two versions of the bills that are moving now, one contemplates selling medical marijuana on January 1st, 2016. The House position has been that we need time to make rules, to make sure everything is in place, so we have put forward a date of January 1st, 2017.
Ms. Lichty, you know, you were here when medical marijuana was 15 years ago. And one of the questions that a lot of reporters, media ask is that these patients, even though they would be legally able to smoke it or somehow get marijuana, in order for them to buy it or to grow it, they still have to obtain it from illegal means, correct?
There's a whole lot of gray areas and silent areas in the current law, and that's one of them. Where do people get seeds, for example? And we were one of the first states to pass the first one to pass it through the legislature as opposed to by voter initiative, because people often ask, well, why didn't we have a dispensary to begin with? Because most states have them now. I think we'll get into that later probably. But it wasn't on anybody's radar at that time. It seems, in retrospect, it seems kind of like they were overlooking something big.
So we were one of the first states to approve medical marijuana. Why is it now taking 15 years for us to look at this again in terms of dispensaries?
Well, I think you'd have to ask the representative that question. I mean, I think it's a political question in all seriousness. As I said, about half of the states have a voter initiative process and half do not. And it's much more difficult in the states that have to go through the legislative process. For many years, until January 1st, the program was with the Public Safety Department instead of in the Health Department where it is now. So I think that was a barrier too. It was in a department where it wasn't a good fit and where their mission was really kind of antithetical to the whole idea of helping people in need.
Mr. Chin, you, as the Attorney General, are you a bit in a quandary in terms of enforcing these laws and rules over medical marijuana?
Yeah, I mean, I think I was describing to you earlier before the show started that it kind of feels like I'm a split personality just because of the way, as the state's attorney, you end up having to represent all the different agencies that are in the government. I wanted to add on to something that Ms. Lichty was saying earlier, because I was just at the National Association for Attorney Generals conference a couple weeks ago, and one of the things that they were talking about when they were surveying all the different states is that every state is struggling, learning how to adapt to introducing marijuana into the picture, whether it's in a medical context, whether it's in a recreational context. There's 4 states that are now allowing that. 23 states plus the District of Columbia allow medical marijuana. And so what was interesting to me was that there are some states that were allowing recreational marijuana but not medical marijuana, some that were allowing medical but not recreational, and and then others were doing neither or both, and so every state is really evolving as this is going on.
What's your biggest concern? If these dispensaries are allowed to propagate, what would be the negatives?
I think from a law enforcement standpoint, to me, it's very clear that there's a concern that if you are starting off with drugs that are marijuana, that it could potentially lead to other drugs. When I said that we were a split personality, this is where the quandary comes up. A lot of people don't realize that when you live in Hawaii, you fall under 2 kinds of laws. You fall under the state laws, and then you fall under the federal laws. And then when I take an oath to be the Attorney General, then I take an oath to uphold the laws of the state of Hawaii as well as the laws of the United States. So it's interesting, and I think that's what we're all seeing, is that medical marijuana is legal now in the state of Hawaii, but from a federal standpoint, it's illegal. Period. It's considered at the same class as heroin, and so whether that's right or wrong, that's just the state of affairs. And so when it comes to law enforcement, that's where the challenge is how do we make sure that we are regulating medical marijuana, which is legal in the state of Hawaii, in a way that doesn't call in a lot of federal scrutiny into what we're doing.
Mr. Shin, are you against these dispensaries?
Well, I think I think we have to really look at marijuana policy and how that's being discussed publicly. And I think the policy now is really driven by public opinion and not really by science or facts. There's a lot more information out there now about marijuana and some of the harms potential harms, especially to our youth. And I think it's confusing because we have medical marijuana on one hand, and it's and some people call it medicine, and on the other hand, we have the federal law that says it's a Schedule I drug. So it's very difficult for, I think, people to have an informed opinion about marijuana in general, because it's a confusing kind of drug. It's that kind of drug that really, it's a very complex, I think, drug, and it's an even more complex policy to talk about.
So, I mean, I guess in terms of people who are within your organization, would they say flat out no, that this is not a good idea, or would they support it at all?
I think, again, it's, I think from a prevention point of view that we're really against any kind of initiative or program that would potentially lead to harm to our youth. And I think what happens with medical marijuana dispensaries or decriminalization of marijuana, it really normalizes the use of marijuana. It really, I think, sends a message to our kids that it's okay. What's the big deal? It's harmless. Why is it against the law?
Ms. Lichty, do you think that a dispensary, a medical marijuana dispensary, would give the thumbs up to children out there?
I don't, and there's actually research to back that up. As you can imagine, these 23 states that have gone forward on this, they're getting a great deal of scrutiny, and there's a lot of research that's been going on. And it's finding that there isn't really any correlation, it seems, with having a legal medical marijuana program and youth use. It hasn't really gone up. The Journal of Adolescent Health said they had looked at all the research, and it seems that the legalization of medical marijuana has not led to an increase in youth. And I think in part it's because the forbidden fruit thing has gone from it. If you're enabling 6 people to get it, and if your auntie's using it for cancer pain, it doesn't make it real sexy or real attractive for a teenager. But I want to say that we share Alan's concern, everybody's concern really, about youth and about kids using it. But the problem is, Ellen, that it is normalized, that the Monitoring the Future survey that comes out of the University of Michigan every year finds consistently that more than 50% of high school seniors say it's easy or very easy to get marijuana. So our position is, if we have a tightly regulated system, which actually cards people and won't let you in the door unless you're 21, that it may be more difficult for kids to obtain it.
Representative, in terms of children again, what are the rules right now in terms of children being able to use medical marijuana, and would they be able to under this new legislation if it is passed? Well,
we do have children who are medical marijuana patients, and on our task force we had one caregiver of Jerry Sugano of MJ, and so there are patients, young patients on our registries. I think the concern about making sure that there's no distribution to minors is top of mind for legislators. So we have provisions in our bills moving that put restrictions on where locations of dispensaries and production centers from schools, playgrounds, areas where we know that there are lots of children. We are very sensitive to that. I think we share Mr. Shin's concerns, and it's certainly something that everyone at the legislature is aware about. We're really trying to strike the balance between public safety and safe access to medicine.
What about Mr. Chin in terms of negative effects in terms of these dispensaries? I mean, there's a lot of claims out there, and is there one that really stands out in your mind that this could be a negative if there are dispensaries out there? Well,
I mean, I think what happens is that we as the 24th state that's trying to, one of the 24 states that has medical marijuana legalized, when we're trying to put in a dispensary, I think there's a lot of good questions about what is that actually going to look like? In other words, is this just going to, I think the anecdotal story that people will tell is that if you're going into a house and you smell a lot of marijuana, then all of a sudden, all these guys who are in their 20s come running out saying, I've got a medical marijuana card. And the concern, whether that's true or not, the anecdotal story would be that there's going to be people who are now growing marijuana and it's going to spill over into illegal activities. One of the biggest concerns that we have is that banks are not going to be comfortable carrying the money of people who grow marijuana or dispense marijuana because banks are federally regulated. There was actually a memo that came out from the federal government to banks that was telling them, you can do it if you want, but you're going to have to make sure that you are very, very, very scrupulous about checking into everyone's background, and if you do anything wrong, we're going to come after you. And so the result of it, the Hawaii bankers industry actually testified that it has a chilling effect on whether they're going to be able to take on any of these growers' savings accounts or any of their accounts. Problem with that is that it's a cash industry then, and right. I think that makes things very difficult. Again, you'll have stories of people saying that, on payday, when the employees of these places are needing to get paid, then that's actually a very dangerous place to be because a lot of cash is being given back and forth. It's also hard to track.
Right. So it's interesting that you bring up these stories because we've seen those stories about dispensaries on the mainland where these owners are having huge wads of cash because they can't, their patients can't use the credit cards, and some people are worried that this is going to attract the criminal element. Do you think
they're
that could happen?
They're showing up on April 15th to the tax office with $50,000 of cash and say, here's my tax pay. It's all in 10s and 20s, and so the department won't know what to deal with it.
But I would say the good news is that they are paying taxes, and they're paying in some places very significant taxes. I mean, they're trying to, I think the good dispensaries, and there are good and bad, are trying to be responsible citizens. And there are moves afoot to try some innovations around this whole cash banking issue, which is complicated. I've heard that Department of Treasury, I guess, memo described as a yellow light. Like, you can do it if you want to, but be aware of all this. So they're talking about co-ops and credit unions and that sort of thing. And Colorado, which is probably for good or evil kind of ahead of the other states, is actively looking at these options.
Joanna from Hawai'i Kai wants to know, who will decide where the dispensaries will be set up? Representative?
So right now in the bill, we have different versions of who gets to, well, really, we have the Director of Health being one of the people who's going to decide. That process of selection in the House version, we were contemplating language where we would have some kind of selection application process. So that is one of the areas where it's actually going to be, I think, in negotiations that will hammer out that last detail.
Mr. Shin, does any of this make you feel more comfortable about a potential dispensary coming up?
Well, I think you can pass a medical marijuana dispensary law, but then when it comes down to the community level, if you ask somebody, are you for medical marijuana, and they might say yes, that sounds great. It's compassionate. Let's help those people who really need it. But then the next question would be, would you want it in your neighborhood? And the answer would be no. And so that's going to be a problem, I think, in terms of where you locate dispensaries. How accessible really are they going to be to our, those patients that need marijuana?
If I could just say so, I mean, in fairness to courageous legislators, I'd say like Rep. Mahealani, who's on the House side, and then Senator Josh Green from the Big Island on the Senate side. These guys are really trying to draft in a lot of regulations so that wherever these dispensaries are, that the health department will be able to really closely monitor everything that's taking place. I don't think that necessarily takes away the concern that people might have if they all of a sudden find out that there's going to be a dispensary in their neighborhood. So wherever wherever a neighborhood is zoned for retail, you could potentially have a dispensary store there.
Well, I agree with you. I think, but the NIMBY problem is always a problem. And I think the comparable would be having a bar in your neighborhood that's open till 2 in the morning, or even a liquor store. I've been to places where there are dispensaries, and they're in nice neighborhoods with restaurants and coffee bars and bookstores, and they just look like every other store. And they're not allowed to have flashy signs. I mean, that's something that can be regulated, the advertising and the signage and that kind of thing. I think they can blend into a retail environment given the right kind of regulations.
Yeah. Mr. Shin, I see you want to jump in there. You think this will really blend in, or are you shaking your head about that?
Well, I think in Colorado, you can look at Colorado, and it's a medical marijuana and legalized recreational marijuana state, and most of the counties there voted not to opt it out, and so often you have to go. I was told, I haven't been there, but I've been told you have to go way outside, main areas to get to these dispensaries. They're in, very isolated areas.
Yeah, Alan, that's not true.
Okay, well, I'm just saying from people I've talked to.
Yeah. My daughter lives in Boulder, so I've been to Denver and Boulder, and I've also seen some dispensary settings in Berkeley. And I don't think it's true that a majority of counties opted out. I know certain cities have, but we can find that.
We can find that.
Figure that one out later. But,
recent studies seem to indicate that when compared with alcohol, marijuana is the lesser of two evils. Do you agree with that?
I think every drug has its impairments and health, issues and dangers. So I think it's not right to really or fair to compare alcohol to marijuana. Each of them has its impairments. Marijuana, has chronic use of marijuana can lead to loss of IQ. It can lead to, it's linked to schizophrenia and other mental health issues. Impaired learning. I mean, if you smoke, you go to school and you smoke a cigarette, you're still probably ready to learn when you go into the class. You smoke a joint of marijuana, you're going to be impaired and not ready to learn. So there are these impairments and dangers and health issues that come from any substance.
Go ahead.
Can I just briefly? We're not saying at all that marijuana is harmless. I mean, every psychoactive substance, including coffee, has harms associated with it. But I do think it's a matter of degree. Alcohol, there are 110,000 deaths every year attributed to alcohol, and tobacco, 430,000, and aspirin, 7,600. So, and you've heard, I'm sure all of you listeners, nobody has ever died of a marijuana overdose. So I think we need to put it in perspective.
One of the things about these dispensaries is that they could sell different types of marijuana. What about, you know, there's different dosages, there's different types, there's edibles. Representative, how do you legislate that?
So in the current bill, we've actually really constricted the types of products. We've looked at capsules, pills, lozenges, oils. I think we are exploring maybe adding ointments and tinctures. So we know what kind of products work. We are not going into the arena of edibles. That was a decision, I think, that was made early on by lots of folks around the table. I know that the advocates really wanted to have edibles, and I understand that for many patients, that's actually a very, very effective way to get the medicine. But I think we want to take the cautious approach. We want to make the product available sooner rather than later. We can look at edibles at another time, but that's going to take a whole nother level of regulations that we don't want to stop this effort right now to do.
Why the concern over edibles?
You know, we want to make sure, just as much as Mr. Shin wants to make sure, that it's not being diverted to the minors. To, you know, and when you see gummies or you see candy bars, you know, that it does raise a question, is that really medicinal? So we want to be very cautious, and we want to make sure we can get the medicine out in a safe way. You know, some of the things that we're really focused on is making sure that there's laboratory testing, so we can actually know, is there mold? Is there pesticides being used? Can we really understand the dosage? So those are the kinds of regulations that we're focusing on now, and we want to make this a solid bill so that we can get effective medicine to these patients.
Mr. Chin, would health regulators be able to really monitor those kinds of things, well, as, let's say, like a regular pharmacy does?
Right. And actually, if I put on my State Department of Health hat on and think I'm representing them, then actually one of the reasons why there was a interest in passing a bill like this among the lawmakers was because it was an opportunity to be able to regulate the quality of the medicinal marijuana that was being delivered to patients. Whereas if it's on the black market, then I think the legislative study that came out was showing that, or the auditor study that was saying that you wouldn't necessarily be able to know whether you were getting, you know, a proper quality or something that was contaminated. Having it regulated allows the health department to actually have a chance to be able to you know, test it and make sure that whoever is actually growing or dispensing it is putting out something that's not contaminated.
Now, you used to work for the city, and I know the police department's not here. The Honolulu Police Department is against these dispensaries, and has always been against medical marijuana. But what would happen to Honolulu Police, let's say, if there's dispensaries? I mean, how would they enforce the law? Or would it be something that they have to turn a blind eye? Well,
no, absolutely not. And I think that's actually one of the things that our office has really been advocating for is the inclusion, not just in allowing licensure of medical marijuana dispensaries, but also including actual criminal provisions. So criminal provisions that are prohibiting unlicensed people from having access to facilities. So if there's a growing area or a dispensary area, you need to have a proper license to be able to enter those areas. And if you're not an authorized person, you know, that is a serious crime. You know, it's that kind of thing. Or there's other criminal provisions, such as if you're diverting your medical marijuana for recreational use. We're also wanting to introduce that into the bill, so that anyone who does that is looking at jail time. Yeah.
On the regulation and policy side, the other thing that legislators are very keen and interested in is the seed to sale tracking. So it's actually providing law enforcement tools to know where marijuana is being grown, how much is being grown, when it moves and gets transported from production center to dispensary center. So we're very mindful that we need to create a system that we can essentially track these products.
Yeah. And I think we're all in agreement on that. The Department of Justice came out with, they've had a series of memos because they're trying to figure out, too, this discrepancy between the states and the federal government's position. And essentially, they laid out 8 conditions. And the message is, if states' programs adhere to these conditions, you know, they will not be free from, they'll still be under scrutiny, but they will be left to do their own thing as long as they're applying these principles. And they're all common sense things like keep it away from minors, don't have any you know, criminal elements involved, and don't recall the others. And we're all in agreement that And essentially that a tightly regulated system is needed.
Mr. Shin, do you think that the entire legalization of marijuana in the state of Hawaii could be just the next step?
I think that's a logical next step. Once you have a production system, a grow system, and a sales system set up, legalization would be, again, normalizing the use of marijuana, getting people to really feel comfortable with it, might lead to legalization efforts. Certainly.
You know, with the states that have legalized marijuana, I mean, some were concerned that, there would be a rise in deaths or there'd be a rise in traffic accidents, but have we really seen that?
Well, again, you have to cite Colorado. I think that's one who came out first with the legalization and the recreational use. And we're seeing, dramatic increases in drug driving. Marijuana's, is involved. We've seen dramatic increases in treatment needs in terms of, especially among youth who have been chronically using marijuana and abusing it or addicted. So we know that 1 in 6 youth do become addicted to marijuana, and that's another fact that doesn't seem to get out there as much.
Well, what do you say to those patients out there who truly believe that this is a medication for them for their symptoms?
Yeah, no, I think that I would agree that marijuana has the potential for therapeutic benefits, but I think it needs to be in a medicine form. And so there are medicines that are now being fast-tracked through FDA, such as Sativex and Epidiolex, that are CBD based. That is the component of the marijuana plant that supposedly has more therapeutic value than the THC. And so these things are being fast-tracked right now. Hopefully in 2 years or so, they'll be out on the market, and it'll be another option for these kinds of these patients who have epilepsy or very difficult to treat other health conditions. That this shows a lot of potential.
I just wanted to add something to it, and just to highlight just what a contemporary issue this is. I mean, today in my email, I actually got Colorado's most recent study that they put out. It's for their 2015 study from their high-intensity drug trafficking unit. And in that study, and of course this is from a standpoint of a state that has legalized recreational marijuana, then they were citing to higher instances of driving while under the influence of marijuana, higher youth access to marijuana, just stats like that. And it just shows you this is a very important issue for people to consider, and something that we should, if this bill does pass, something that people should be very, very careful about.
But I think some of that is a little bit misleading because, as you know, there's no test for current impairment for marijuana intoxication, unfortunately, as there is for alcohol. So instead you look at the metabolites in the person's urine. And they can stay in there for 30 days, up to 30 days if you've smoked marijuana in the last 30 days. So it doesn't necessarily measure current impairment. And as I said, everybody's scrutinizing Colorado very closely. I think I'm looking at different research than Alan is. But it appears to me, and I think to the people of Colorado, that the sky is not falling in, that dire things are not happening. And they're also, they're adjusting their system as they go along. And they've recently begun to redesign the packaging because they recognize some of them are too attractive to kids. So they are being, I think, very responsible and proactive to try to adjust this brand new situation.
I think we're really talking about big marijuana, though, and I think it's like the alcohol and tobacco industry that we don't want to create in Hawaii. I think it's out of control in Colorado, and I think the bottom line in Colorado really is profit and money. It has less to do with compassion, in my opinion, than it does with profit. And so you're creating these industries that will have unintended consequences and social costs, much like tobacco and alcohol, where you might collect some tax revenues, but the social costs will far outweigh them.
Is there representative? Is this the new cash crop then? In terms of taxes and revenue?
Not in my view. The House position has been just to apply the general GET provisions to medical marijuana. And let's be very clear, we are not talking about legalization. There are folks in the legislature who want to push decriminalization and legalization. We haven't pushed those bills this year. So this is really about how do we get safe medicine to patients who currently exist, and we know have to purchase it on the black market. So we are in fact trying to curb the black market in this instance.
We're talking about medical marijuana dispensaries in Hawaii tonight. Please call, email, or tweet your questions and comments. Call 973-1000 if you live on Oahu, and 800-283-4847 if you're on a neighbor island. One of our viewers wants to know who will set the prices of medical marijuana. A representative, how much does it cost now, and who regulates how these dispensaries sell it?
I frankly don't know how much it costs, but what's going to happen is that the free market will determine it. So maybe Pam,
I can't say offhand. Alan probably knows what it's selling for.
No, Doug knows.
How much is it?
But the point is that, we already have big marijuana. It is the black market. And it's a matter of getting things under control. And in terms of pricing, if you price it too high and if you tax it too high, then people are going to still go to the black market. And so it's a really fine balancing act. There have been some very in-depth research in Washington State, actually, looking at what's the sweet spot on taxation so that people are using the proper system and not going outside.
Mr. Chin, let's say these dispensaries are allowed and the bills go forward. Would someone be allowed to, let's say, take it on a plane?
No. No. And I'll tell you why. It's because planes are regulated by the federal government. And the other interesting thing that's unique to Hawaii is that because we're a series of islands, once you fly out a couple miles away from the beach on your Hawaiian Airlines flight, then you're no longer in the state of Hawaii. You're just you're in a different territory, and the federal laws of the United States apply. And there's a Controlled Substances Act that still is in effect that still says that marijuana is illegal. So that's actually been one of the interesting issues that the lawmakers have really had to deal with and discuss, is how do we take care of Lanai or Molokai and just the other islands, because you cannot transport, you can't even put it on a ship or a barge because, again, you're regulated by the federal government.
As things stand right now, I mean, these medical marijuana patients are still obtaining seeds or obtaining plants from an illegal source. So have you seen prosecutions, federal prosecutions of medical marijuana patients?
Well, it hasn't happened, although what I would say is that, that's the interesting thing, is that in other states, when they are not doing enough to show that they're making the effort to regulate their industries, the federal government is not hesitating to step in. So, for example, again, this is just how current this issue is that in today's local daily paper, in the first section, there was an article that talked about how there was a crackdown on a Metapod, place in California. And how, when there are places where the state laws are not strong enough, the federal government is not hesitating to step in and say, we're going to.
But a point was made in that article that was a pre-existing case before these recent memos have come down for the Department of Justice. And so this guy is kind of caught in a bad situation. He was actually running a dispensary, I don't recall what California town, but with the concurrence of the city council, and it was all above board. And for whatever reason, the feds decided to target him.
Can I speak to this? Because we have struggled with this, and there have been legislators who want more home rule on dispensaries, but it's the California experience where there is not a well-regulated statewide law. What they have is competing counties with all sorts of different regulations throughout the state. So what we're trying to do here is create a solid state law that respects public safety, safety of children, access to medical marijuana, and so that we can give the tools to law enforcement and we can have a solid foundation for medical marijuana dispensaries moving forward.
You know, a woman from Kailua wants to know about, she said she heard on the Dr. Oz show that there's a variety of marijuana that doesn't provide the high and is actually provides relief that patients need. Have you heard about this?
Yes, of course. There's about, I guess, 70 or more active substances in psychoactive substances, and the one everybody knows about is THC. And THC is even approved by the federal government. It's in Schedule 3, and it's available as a pill called Marinol. But there are also compounds in marijuana called cannabinoids, and those have been found to have really effective, are really effective for certain kinds of conditions, like the child with epilepsy, for example. But there's further research has shown that it's not, there's a synergy that goes on when you use the whole plant, and that some THC helps effectuate the CBD, and it's not that simple. And some states have actually gone the route of passing CBD only bills, that the oils and so forth. There are some very conservative states like Utah, but it's not the same, and it's not as good.
Mr. Shin, I see you wanting to weigh in there.
Well, no, I think that, like I said again, marijuana has some potential health benefits, therapeutic benefits, but it hasn't been FDA approved. Although FDA, everybody says, well, if marijuana was legal, there'd be more research on marijuana, then we could really learn about the benefits. Well, FDA has spent over $14 million on marijuana research trying to find out, you know, is it effective with post-traumatic stress syndromes, with heart conditions, with cancer? And there's nothing conclusive yet.
Oh, I agree.
So I think that, you know, there is some, I think there is potential, but I think there needs to be more research, more testing, and again, this fast-tracked, some of these fast-track medicines that are coming out in a couple of years, I think they have some potential to maybe help some of these health conditions that we've been talking about.
Ms. Lichting?
I'm sorry to make a face, but I really have to disagree on that one. There actually is a large body of research, but there had been big barriers to research, and that is that the National Institute on Drug Abuse has to approve the studies. They have to go through many more layers of approval than research on a regular drug because they're in Schedule 1 under the federal government. And NIDA's mandate is to look for the harms of drugs. And so the research they've approved over many, many years is to look for the negatives. But only now is there beginning to be a body of research, and in other countries like Israel too, that look at some of the more beneficial effects.
Alice from Honolulu wants to know, how are they planning for education in schools and colleges as well as family and the community? Representative?
Well, we are saying and asking that for the dispensaries that there be a health educator. And I believe we may be asking that there be a health education specialist in the Department of Health. So I think we can learn a lot from what they do for alcohol and how to talk about it, how to teach the dangers of it. So there's certainly a piece of that. Can we strengthen it in the legislation? Certainly we can do that. Can we find resources to put toward that effort? We can do that. But that's all going to be something that we have to keep moving and working on.
Mr. Chin, your thoughts about that in terms of education? You know, schools, families. I mean, it's maybe the DOE side.
Right. It's a critical component. In other words, if medical marijuana dispensaries are going to be in the neighborhood, we're talking about a sea change that's occurring in culture. I mean, for all of us who grew up, we were told marijuana, that's a drug, that's illegal, and I think the idea that people are stepping into is just this idea that, well, marijuana has a use for a certain population that needs it for medical purposes. And so that kind of education is very important so that people can be able to know, you know, again, how to conduct themselves under this new kind of thinking.
Mr. Shin, what do you think about a Department of Health educator?
Well, I think Department of Health has, you know, an arm already that does some of that, and that's the Alcohol and Drug Abuse Division, which, you know, funds prevention as well as treatment services throughout the state of Hawaii. I'm all for, of course, education, but again, you know, marijuana is one of those drugs that is often driven by rhetoric, myths, misfacts, all kinds of things. And it's really hard for, especially parents, to talk to their kids about it. And I did bring this Marijuana Talk Kit article. It just came out, and it's, I think, can I hold it up? Mm-hmm. And I think it's a great start.
You can hold it right. Here, there
so
we
this
go.
way?
No,
this way.
I'll hold it up.
There you go.
She knows where the camera is.
Medical marijuana talk kit. So what's in this kit?
So I think it goes step by step with parents on how to talk to kids about marijuana, to try to tease out the facts from the fiction, to really engage the child or the teenager, probably adolescent, in talking about marijuana. So I think it's a good first step. But we need to really take more of a public health approach to this whole marijuana issue. And so if we did that, we would be talking not just decrim, we'd be talking decrim not just for adults, but for youth as well. So most of the decrim bills that have come through the legislature deal with adults and not the youth, where they're probably more heavily penalized for using marijuana, experimenting with it, in terms of affecting their futures, like their jobs, getting into college, and I don't think that's right. So if we're going to do it, let's
so
do.
You're for decriminalization?
We're with the public health approach.
Good,
Yes,
good.
You know, it's
We're on
interesting.
the same
We
page.
talk about public health, and there's a lot of sort of basic questions about
Sure.
marijuana in general. And someone wants to know about secondhand smoke, and they say, I live in a condo. Is secondhand marijuana smoke going to affect me and my kids? What do you have to say about that, Mr.
Well, I think New York took a very interesting tact, and they said they're outlawing. They just passed their medical marijuana law, and so they haven't implemented anything yet. They're still going through the administrative rules, but they are proposing to outlaw smoke marijuana in terms of sales, and that's because of the secondhand smoke from tobacco. They're relating that to the tobacco experience. So that's a very interesting kind of strategy that New York has taken.
And they're the only state that have done that, and they're getting a lot of criticism for it. They have a law that's so tight that people think it's unworkable. And patients increasingly prefer not to smoke it. Mm-hmm. They want to vaporize, which brings it up, to a level to release the gases, but it doesn't actually combust anything. It's much safer, and there isn't really any issue about secondhand smoke. But smoking is particularly useful in certain conditions like nausea from chemotherapy, because it instantly stops it. It's an instant delivery system, whereas, and vaporizing pretty much the same, whereas some other methods are slower onset, and you can't eat something if you're severely nauseated.
Representative, in terms of actual medical marijuana and these patients right now, I mean, there are certain areas where they can't smoke it, or they can't.
They're not allowed to smoke it in public. Period.
Right.
And what about if these bills do pass in terms of dispensaries? Where would they be able to do it?
The same prohibitions still will exist. They will only, technically, they're only supposed to now be smoking it in the privacy of their own homes, or using it in the privacy of their own homes. They're not supposed to be using it in public.
Here's a really interesting question. Mike from Hawai'i says, will my health insurance cover the cost of medical marijuana?
No, it will not.
I didn't think so. I didn't think the insurance companies would cover that.
But if it was a medicine base, it would. It might. So if we
Like
have something
yeah,
comes
do you think that would ever be a possibility, or?
Yeah, sure.
Yeah.
When the FDA approves it, when the scheduling is changed, and there is a lot of pressure on the federal government now to change the scheduling, because the Schedule 1 is the most restrictive schedule for any drug, and it's supposed to meet 3 conditions, and they're high potential for abuse, which we could argue about, no currently accepted medical use, which is ridiculous since 23 states and DC are now accepting it, and a lack of accepted safety under medical supervision. And I think most people would agree it's a safe drug compared to most pharmaceuticals.
I could tell you something, and since I'm sitting next to the representative and the bill is still in play, might as well do a little lobbying. But I can think through, it's just some things that are really important to us, is that when it comes to deciding, well, who is the type of person that's either dispensing this marijuana or using this medicinal marijuana, there's oftentimes people who question, they don't have a problem with someone who is has this Queen's Kaiser physician, you know, that's just, you know, that is from the, you know, the mainstream, who is, you know, treating somebody for cancer. But what they're more concerned about is and there's phrases that are in the bill that we'll talk about, you know, you just have to be a healthcare provider. Well, what's a healthcare provider? You know, that really should be defined. You know, is that your podiatrist? Is that your, you know, is that your masseuse? Is that your shaman? You know, what is that person? And so we would really like to see those definitions a lot more clear,
more defined,
so that, because I don't think you know, I think just like we all agree that, you know, youth shouldn't be exposed to this, we all agree that there's probably going to be good, responsible people and good, responsible dispensaries that handle this. I think what we're all worried, or what we are worried about, is there's going to be all the people who flaunt the law and try to push the edge and you know come out waving their card and you know, doing things like that. That's the concern.
Are you concerned about age? You know, will there be a minimum age to obtain this?
Right. Well, I mean, I think that you guys can probably answer that question.
I think right now it's 21, or is it 18? I think it's 21.
To obtain...
To go into a dispensary.
There will be restrictions about who can go in, and we're looking at only those people who are card holders to go in to an actual store. We're looking at security measures such as double doors, cameras. I mean, there's going to be a whole slew of things that are going to ensure that there's very restricted access.
But right now, I guess the bills that you have on your table, there's no minimum age.
For someone to be a card holder?
For someone to be a card holder to go into a dispensary.
Well, truly, because it's going to be a physician-patient relationship. If a physician wants to write a card for an epileptic who's 7 years old, I'm not going to stand in the way of that. That's a healthcare decision. Now, who can go in to purchase for that 7-year-old? Clearly, it's going to be the primary caregiver of that. The parent is going to be the one to go in to purchase.
In the dispensaries I visited, you have to be above 21. And you go into a little ante room and you show which cameras on you and everything, and you have to show your ID, and you have to show your card, and you don't get into the inner sanctum until you do that. It's in their interest to obey the laws of their state, and they want to stay in business.
But these current bills on the table, they're not saying minimum age 21, correct?
You know,
I think there is an age requirement, at least for the dispensaries. In other words, the people who are operating the dispensaries, they have to be.
Well, yes. Here's my opportunity to lobby the. You know, I'm a mom. I have a 7-year-old. I can't leave that 7-year-old in the car because I'll be breaking the law. So I want to bring her in, and if that's a 7-year-old, you know, I think there needs to be a little bit of leniency. We can certainly apply, you know, 21-year-old. I think that's reasonable, but we have to figure out how do we write it. Is it something that's statutory or regulatory, so that we can allow for some leniency? Because really, I mean, I'm not going to leave my 7-year-old in the car while I'm going to go pick up her medicine. I'm going to bring her in with me, or maybe there might be a provision where in the ante room.
Yes, that's like a waiting room.
The waiting room, someone is there to supervise her or him. So we have to look at those kinds of things.
Right.
You know, we have a comment from Jesse Ryan Cavella Allen, and it's directed at you, Mr. Shin. He says, this guy from Drug-Free Hawaii is spewing lies.
Oh.
Do you want to respond to that?
What specific
He said
lies are you talking about? Which one?
FDA does not perform research. Dispensaries in Colorado are in very prominent neighborhoods. He's giving incorrect information. I figured you better respond to that because he seems pretty angry.
Well, FDA, lying about FDA, that they don't perform research. I think he can go Google it and find out that really there has been a lot of research done on many health conditions. So FDA, you know, their job is to save lives, to make the medicine, potential medicines safe, and hopefully they're effective also. So I think that's their job, and that's what they do. And they do it very well, although they do it very slowly sometimes, and people are impatient and are waiting for some of these drugs to come out that have potential to really help people. So I think that could be his beef. Yeah. But he should go Google it, I'd say. And what was the other lie?
There were some other people upset. You know, obviously these are the people who are
about Colorado, about
that they're in out-of-the-way neighborhoods.
I'm just telling you from my experience with from people who have talked to me about it, where they had to go way out, take 2 buses to get to the dispensary.
And you disagree with that, right? These dispensaries are in just regular.
Or it does happen.
If any of the viewers know Boulder, Colorado, there's a very prominent pedestrian section of town where all the good restaurants and hotels and everything are, and there's 2 or 3 right along there.
I mean, here's my guess: is it's both. I mean, you know, so in other words, again, the concern is that you don't really worry about the prominent, well-placed, licensed dispensary. It's more the other people who are licensed that are shadier, that are, like big tobacco or something. They're just, or even worse than that, some sort of organized crime unit. That's the, that's the concern.
And perhaps the one in the out-of-the-way place has some esoteric type that the others don't carry, and so it's worth taking 2 buses.
Philip from Honolulu brings up an interesting topic, and he wonders, can a landlord prohibit the use of growing medical marijuana within a leased apartment? Do you know, Representative?
I don't think that there are any protections to prohibit that kind of discrimination, but there have been measures moving through the legislature to tackle that head on. It's not something that we're going to address, I think. There may be one bill moving.
Actually, there is one bill.
One bill still moving.
That would provide not only protections for people who are renting, but for patients, qualified patients that are renting, but also in parental rights disputes, custody disputes, and things like that. So I think it's very interesting. It's going to be going to the full House soon.
Let's say let's say there's a landlord. They could not prohibit, let's say, marijuana plants from being on their property if they were renting.
I don't think I can give a straight up or down answer on that. Yeah. It's fuzzy.
I think it's in their condo law,
That's right.
Right?
It would depend on. It also would depend on. There was a thing about, can they smoke marijuana there? Well, then the answer was, can they smoke tobacco? And if they can't smoke tobacco, then they can't smoke that either. So it's brand new law.
The great sense that I get from the viewers is that, here we are, we can talk very intellectually about it, but I think when people are watching this, they're just thinking, I don't want to be smelling it, next door to me,
That's the basic question.
I don't want to be seeing my kids. And I think that's the concern. And it's a legitimate one, because that's what people wonder about, even as we're talking about it.
Here's my bigger concern. We know that people are doing home grows. We know there are patients on all islands. So you may be living next to someone who's growing, and they may be growing a lot of plants if they have multiple card holders. And one of the things I fear, especially in densely populated urban Honolulu, I don't want to be living next to a condo that has like 28 plants. That's frightening to me. So for me, some of this regulation is to contain that again, and to provide access so that people don't have to be growing these things and producing. Some of the production methods that they use in the homegrown system is very dangerous. We hear about houses being blown up, fires occurring. That's the kind of stuff that we want to actually stop. And this law will kind of curtail some of those things.
If this gets approved, what would be the timeline? When could we potentially see the first dispensary, medical marijuana dispensary in the state of Hawaii?
Again, under the Senate version, it would be January 1st, 2016. The House is taking a little bit more conservative approach, and we're saying January 1st, 2017, because we have to get all the regulations into place. We have to have the selection criteria. We have to ensure that there's lab testing, that there is a C2 sale tracking system that the regulators have and that the licensed applicants have. We have to do quite a bit of work to even get this off the ground.
But would that be when the first licenses are issued? Because from that time, there's still some lead time before they have a product.
So in the latest House version, licenses would be issued June 2016.
Yeah.
And then there would be 6 months, and for the production grow and finalizing of all the business, and then sales first on January 1st, 2017.
And how would you see that? Let's say, and we start seeing these dispensaries. What's next?
Well, I think we should back up a little bit, and I just feel that we probably need to take a better look at this whole issue. And I think in the medical marijuana dispensary task force, we talked about surveying the 13,000 medical marijuana card holders and asking them, what do you really need? What do you really want? There were public hearings, yes, I know, on two islands, but we didn't reach out to places like Molokai and Lanai and some of those other places that, do they even want dispensaries on their island? I don't think we have that answer. Mm-hmm. So to me, it's not clear. Do they need it?
There has been polling, however, that showed QMark Research in Honolulu did some polling in 2014 and found 85% approval for dispensaries. When the people were set we're told this law's been in place for since 2000. There's no way to obtain it except to grow it. What do you think about dispensaries? They went, yeah. And we are also, I don't think we've mentioned this, one of only 2 or 3 of those 23 states that don't have some sort of dispensary system either up and running or in the works. So we're really behind the curve.
Representative, one thing that you do as a lawmaker is you count votes. And, you know, if you're counting votes, how likely is it that this bill, in some way, shape, or form, will pass this legislative session?
I'm very optimistic. I think it's time. I think everyone recognizes that it's time and that we've actually left a whole cadre of people without access. So I'm very optimistic.
Even if it gets to the full House or the full Senate?
Yes.
And your thoughts on that?
I mean, I think that's why we've taken a pragmatic approach. I mean, from a law enforcement sense, there's a big concern about you know, what's going to happen if we open the door a little bit more, which is essentially what I think some of the viewers are thinking about. But the pragmatic approach is, if it looks like the votes are in there and it's going to pass, then let's be involved from the very beginning.
Right.
Let's be in the discussion. One of the things I really appreciate is how the health department, those people have really studied out. They've been like calling every state that has laws like this to find out what's working, what's not. The sad thing is there is no perfect state out there, but if we can learn as many lessons as we can, that's a good thing.
Well, I wanted to thank you all tonight for a really lively discussion. There's a lot more questions that people have, and I'm sure we'll be talking about them in the coming days and the coming weeks. Thank you so much for joining us tonight.
Thank you.
Well, they served our country and were promised benefits that include medical care, scholarships for higher education, and burial services. A 2014 national audit showed that about 117,000 Hawaii veterans may have been affected by delays in processing their benefits. While improvements have been made, delays still remain. Are we doing right by Hawaii's veterans? That's next time on Insights on PBS Hawaii. I'm Mahealani Richardson. Ahui ho.